Everyone, Wausau Mayor Katie Rosenberg right here with my friend who I haven't talked to in feels like a little bit here. Laura, how the heck are you?
I'm good. So I'm Laura Scudiere and I'm with the Marathon County Health Department.
I can't remember your title off the top of my head
Yeah.
right now because it changed. So I'm like, who's Laura?
Yeah, now I'm the Community Health Improvement Director.
Improvement Director. That's right.
Yeah.
It seems super important and fancy. It is.
I like to believe so.
Super important. Yeah. I think you're directing health improvement right now, doing these videos with me. So thank you.
That's great. Wonderful.
Cool. We were talking about what we should call this little show here, and we're calling it Three Things because we're still doing the three things, but there might be a change. We might rebrand at some point here.
My hope is that at some point, Katie, eventually we will get beyond this pandemic and then have to branch out into new topics.
I'm so excited to talk about other topics with you because I know that you are so knowledgeable on all kinds of really interesting things just based on what we were talking about 5 minutes ago.
Right.
Off the recorded version.
Right.
And public health related.
Right. Public health related. I have lots of things that I like to talk about that are related to public health from my experience, but it doesn't
super interesting stuff. Yeah.
Right.
Okay. Well, we're going to talk about other things other than the pandemic at some point, but right now we're still kind of talking about it because I guess we're mutating here.
Yeah.
We're entering a new season of this. So that's actually my first question. Delta variant. I'm seeing people talking about it. What do I need to know about the Delta variant? Should I be? I didn't preview this question with you, but should I be masking again? Talk to me about this.
So the Delta variant, so you use the right term, a mutation. So it's a mutation off of COVID-19. So it is COVID-19, but it's a different mutation of it. And currently we call it a variant of concern. We don't want it to become a variant of high consequence. So all these variants, we put them in like a different order. And so we don't want them to become more and more concerning. And so what does it mean that it's a variant of concern? And what it means is that it has mutated so that it transmits faster and that it sometimes causes more severe disease. And so it's more contagious. So that's why we're concerned about it, Katie. Yeah, and the thing is that there was variability with testing specifically for the Delta variant versus other variants. So we actually, in our area, Katie, we don't have a full sense of how Delta is impacting America. So we suspect that it's here. We think it's out there. If you feel safer masking, or if you're gonna, and you're fully vaccinated, you feel free to do so. Right now, the CDC's guidance is that if you are fully vaccinated and out in public,
still okay. Oh, I heard from one of my friends that they knew somebody that had the Delta variant, and that person had already had the non-Delta variant of COVID, so they were experiencing it again and kind of upset about that. So vaccinated, wash your hands still a lot, make sure you're taking some of those precautions. I've noticed some people pulling back on handshakes again while other people are going straight into it. So I still don't know what I should be doing. So it's kind of an awkward mix of hand gel handshakes.
Right. I've started the business salute, or
the business salute. Yeah.
Which, in public health, when we go into rooms with each other, if we're meeting other public health people and you shake hands, you're automatically considered
ostracized. Right. Okay. I spent some time in Japan and I loved the bowing, and you bow at different depths depending on who you're talking to. I think that's kind of interesting. So maybe we can make that a comeback here in Wausau.
Yeah, I can't get into the elbow touch, but
yeah,
but I do
still like getting their face a little close to you.
Right. Yeah. I do like a professional nod of the head. I think that's like a sign of respect.
Yeah. I like it.
We should get it going, Katie.
Okay, let's work on it. Okay, so here's my other question, kind of related. I'm hearing people talk about the Guillain-Barré Syndrome, and I'm wondering, hey, what can you tell me about this? Do we have risks here that I should know about? Or maybe I just went forward into things not considering this as a risk for myself. Talk to me about this. I'm sure I mispronounced it too.
Oh no, I actually looked up the pronunciation because I was saying it wrong myself. It's actually from two French people.
Okay.
And so it would in French it's like pronounced guillain-barré or something like that.
Okay.
But in American it's guillain-barré. And
GuillainBarre. Okay.
and what it is, it's basically it affects your nerves. If you have it, it's like a like you become immunocompromised, and it affects your nerves. And uh, and just to give you a sense of it, only 100 reports of this out of 100 reports out of 12.8 million doses were recorded. So
Okay.
again, this is another one of those things where is your risk zero? No, but it's very low.
Okay.
And there's no increased risk for, and that's just Johnson and Johnson. There's
Okay.
no increased risk of this for anybody who received Moderna or Pfizer. And just to give you a sense of it, like the chances of you getting this are much, 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 much less than your chance of being hospitalized and dying of COVID-19. And
Yeah.
so, you got to do the math there. So that, and, is it a big concern? If it was me and I was getting had the choice of Johnson Johnson or nothing, I would take the vaccine, because
Yeah.
we're getting a lot of people in the hospitals right now that are unvaccinated. The majority of the hospitalized people from COVID-19 infections are unvaccinated.
Yeah, I was talking to somebody from one of the local hospital systems, and that's exactly what they said, that the people they're seeing, and some of the complications are severe when you get COVID-19. So it's better to vaccinate yourself and protect yourself and others. So,
Yeah. Hey, next time, okay, let's talk about COVID long haulers.
oh my gosh, let's do it. I think I actually know a couple. Maybe they'd be willing to talk to us about what they've been going through.
Yeah,
So,
yeah, let's do that.
okay, let's do it. Okay, so we don't want COVID long haulers. We don't want COVID. And I know we talk about this all the time, but I think it's worth being the third question on three questions or three things. Let's talk more about where you can still get the vaccine. I know we've got the clinic, we've got everywhere, but
Yeah.
what do you know? Where should people go?
Yeah, easiest place to do is to go to, if you have internet access, is to go to vaccines.gov and put in, and you can even click on what kind of vaccine you want, or what radius miles you're willing to drive, and it will pop up.
0.
Yeah, you could.
There it is at Walgreens.
Right. I mean, you could pick within a certain radius and then go wherever. It's Walgreens, yes. CVS is yes. There's clinics. There's a clinic still at NTC that is operating. Aspirus, Marshfield, Bridge Community Health Clinic, Ascension, all of them are vaccinating right now. And so you just got to find out where, and it's free. I should say that again. Like, it's free. You just go in.
0 money.
No money. No money. Yep. And then sometimes you get a button or a sticker.
Ooh.
Yeah.
I like the button. You can use it. Although I did stick the sticker on my computer, so
Okay.
everyone knows. It's the important part.
Yep.
Okay, so I'm noticing a lot of my friends, finally going back to the doctor with their normal stuff, and they are getting the big kudos from their doctor for already being vaccinated. So it's another thing.
Mm-hmm. Yeah. It's
I want my doctor to think I'm doing the right things.
right, and we're anxiously awaiting for full FDA approval of the vaccines. They're under emergency use right now, and we expect that after that gets approved, we'll get another bump of people who are interested and willing to get vaccinated.
I just wanted to make sure. Yeah.
Yeah, and I cannot say enough things about the safety and efficacy of the vaccine. Like, you've heard me talk about it a lot on this video with you a lot, Katie, but vaccines are safe and they're effective, and we are monitoring. It's the first real-time live. Every single person has the ability to tell the government through various monitoring whether or not they've had a side effect. And so this is the biggest effort that we have ever had on safety that is real time like this. And so it's that's kind of noteworthy. It's historic.
Totally.
About how safe these vaccines are, considering all the situation we had to deal with this last year. Like it's a very safe vaccine.
Awesome. Safe. Good. Well, thank you for helping me through these 3 things. We're not going to let it be this long until we do the next one. So
All right.
awesome. Appreciate you. Have a lovely afternoon.
Thanks, Katie.